Welcome, everyone. My name is Paul Kohlhaas. I'm the CEO of a protocol called Bio, and also the founder of an organization called Molecule, which work together in unison to create decentralized science, or to really enable scientific research to come on chain. Super quick background about myself. I spent a lot of my, I have an atypical background actually to be working in science. So I'm not a scientist, but I spent a lot of my teenage years in online biohacking forums. So these were like obscure little Reddit forums, different communities, focused on diabetes, for instance, or HIV, gene therapies, really got into nootropics, psychedelic research, longevity research. And what I saw in common between all of those communities was really kind of the power of online open source collaboration. If you've ever spent time on Reddit, I mean, there's Reddits for everything. And you can quickly communicate with the utmost experts in their field, be it knitting or chess, and just ask a question. And people will answer them for free and just be like very engaged kind of for this common pursuit of knowledge. I also realized that a lot of these communities are actually there out of sheer necessity. So you had patients that couldn't afford a specific medication and were looking for an alternative online. Sometimes engaging in really dangerous practices, but just out of sheer necessity. I studied economics and began trading biotech stocks during my studies and had a complete opposite experience. If you've ever invested into biotech, it's very gate-kept. The reporting requirements are very slow, meaning you have almost no information or very little information about the companies that you're trading. There's a lot of insider trading. And then I got into crypto in about 2014, started my first company, building software on Ethereum. And in crypto, I had a really different experience again. So crypto markets are fundamentally driven through being completely open, right? So you can look at the code base. If someone finds a bug in a, can we get it back? If someone finds a bug in a code base of Bitcoin, for instance, or like another crypto project, that is extremely valuable financial information, right? You could now hack this protocol and like, I don't know, short the market, or you could reveal the information and the market would extremely quickly react. And so my fundamental thought process became like, what if biotech or science worked in a similar way where you actually have financial markets that are being driven through open data, through open access? And that's what I'm here to talk to you about today. Cool. So Bitcoin enabled permissionless money to enable an alternative to the Federal Reserve. I think we have all seen what has happened to inflation over the past 4 or 5 years. Ethereum enabled permissionless code to enable an alternative to banks, fintech, and Web 2, essentially kind of open financial markets, open financial systems. And I think most of us, if any of you invest into crypto, we invest into crypto because we believe in sovereignty, in liberty, and in kind of open source access and freedom of speech. And I think because something is being taken from us on those values, kind of slowly and silently. And science and medicine, in my view, are trapped really in very similar power structures, where things are being taken from us slowly and silently. And the biopharma industry, or many kind of scientific industries, have always been kind of too big to change. Academia is too big to change. Pharmaceuticals alone, or GDP, like healthcare in the US, consumes about 18.5% of the US's GDP. And that is kind of underpinned by a patent system that was developed in the 19th century. The last upgrade actually to the patent system was made in the 1950s, kind of the last regulatory upgrade, which is nuts if you think that it's like the basis for how innovation is enabled and protected. Treatments and recurring revenues, unfortunately, really dominate healthcare today. The system that we've created today needs lifelong consumers, and it disincentivizes cures. So there's a famous Goldman Sachs article from 2018, which is titled, "Is Curing Patients a Sustainable Business Model?" And the article argues that no, it is not a sustainable business model. It's based on the analysis of a drug that GlaxoSmithKline launched, which treats hepatitis C. And previously, there were a lot of companies on the market that had treatments for hep C, but not a cure. And so this was a new cure, 6-month treatment, pretty cheap, and it just cures people. And so Goldman Sachs was like, why did you guys develop this? That was a terrible business decision. You've cured your customer base. And I think the CEO at the time, or not the CEO, but like an executive at the time got fired, and the company was downgraded. And this is how financial markets and the system that we've created kind of responds. There's another figure which are US overdose opioid deaths involving prescription opioids. And so this is another big market failure where I'm sure many of you are familiar with the opioid crisis in the US that kills tens of thousands, if not in the hundreds each year, fundamentally coming down to this question of like, we need lifelong customers. We don't have an incentive to cure people. On the other hand, scientists spend 80% of their time applying for funding and 20% doing the science. This is one of the first scientists, Dr. Martin Scheibe-Knudsen from the University of Copenhagen that we ever spoke to, said like, this is his day-to-day. Imagine if that was the case in software development. Imagine if software developers had to spend 80% of their time like getting money or some approval to write a piece of software instead of actually just writing the code. So I posit that most of the world's potential scientific talent actually remains untapped because we're not enabling it. And we really live in a time of science fiction and not of science fiction. All of those cool pictures that we see of like, ooh, the solar punk future, if only we had like, well, we don't have it because we're not really upgrading kind of the fundamental substrate of science and technology. So DeSci 2049, which kind of plays a little bit into the Token 2049 series, for me really is about permissionless science. It's like, what if we enabled or built a world that was fully permissionless? So some of you may have seen this announcement. I think it only came out yesterday or the day before, a Nature article where a scientist treated her own breast cancer with a virus that she developed herself and grew in a lab. And so she developed this, didn't get approval for it, treated herself with it, and it works. Or at least it seems to work in some of the preliminary data. And then, so she self-administered this to help treat her own stage 3 cancer. And she's been cancer-free for 4 years, it says here. And in choosing to self-experiment, Halasi joins a long line of scientists who have practiced this under-the-radar, stigmatized, and ethically fraught practice. It took a brave editor to even publish this report. Otherwise, we wouldn't even know about it. And then this guy is super cool. You can follow him, Intellectualist. Scientist does science, cures cancer. The science TM, no, you can't do that. And then you wonder why most scientists are fleeing academia. So I think this is a really good summary of why permissionless science is really important. So we believe that we need to enable self-sovereign science, kind of medical freedom driven by open data, and liquid markets where cures actually become selling points for people to fund. Very quick overview into kind of the two organizations that I represent. On the one side, we're trying to figure out how do we bring science on-chain in the form of IP. So Molecule is really a protocol and exchange for on-chain IP that turns siloed individual research into liquid markets that are powered by open data. And on the other side, some of you may have heard about Bio and Bio-XYZ, Bio Protocol. Bio is really a curation and liquidity protocol for scientific communities. So we bridge DeFi into DeSci and empower scientists, researchers, patients, investors to collaborate on chain and form Reddit communities with a bank account that can now fund science and actually build an IP portfolio in a similar way that a pharma company does. Very quickly, this is kind of like a little bit of a primer. I'm sure some of you already know about this, but like, what is a bioDAO or a DeSci DAO? A bioDAO really creates value by building an on-chain IP portfolio and then can directly either commercialize it to its community, or it can sell them on to development partners. So you have a DAO that forms. There's a vetting and approval process within the DAO through the token holders. Again, as I said, the DAOs can consist of various experts, scientists from all over the world, patients. They raise funding. They then fund specific research IP, and that can be commercialized through a variety of ways. And then the proceeds flow back into the DAO to fund more research. These are some of the featured projects from VitaDAO, for instance. So VitaDAO has already funded over 6 million in research to date. I actually think it's more than that, it's around 8. One is with the Scheibe-Knudsen lab that I mentioned earlier. One is with University of Oslo, for instance. Another one with Newcastle University. Newcastle University, actually, the project took 3 weeks from us first talking to the researcher to the IP and this research project being fully out licensed and the university having its money in its bank account. And now 100% of the IP is owned by VitaDAO. It's actually been follow-on tokenized, so it's now being, we sometimes turn these research projects, the successful ones, into like mini sub-DAOs. and I'll talk more about that in a bit. If you're interested in the science, this researcher, Dr. Kowalczuk, actually looks at novel autophagy activators. Autophagy is the process in the human body where healthy cells eat the old cells. It's often triggered by the effect of fasting. I think he has 3 drug candidates now that are actually in preliminary data showing better data than rapamycin as a potential novel longevity drug. In 2023, our team has helped build and launch over 6 different bioDAOs that has raised over 13 million in funding total and are today valued at over 70 million collectively. I actually think this is outdated. This is probably 120 million at the moment. There's been a big rally in the market, as maybe some of you have seen in recent days, which for me is always incredible because it just means that these teams have much larger treasuries to fund science. I'm going to talk a little bit about Bio. What is Bio specifically? So with Bio, we're blending DeFi and DeSci to really create kind of a new category, which we term science finance or sci-fi. Bring sci-fi back. One of the largest problems that we've seen that many DeSci founders, patient scientists have had when kind of entering the Web3 ecosystem is navigating it. Crypto is famously a bit crazy and can be rife with scams. You really need to know kind of which side of the market that you're operating in. And so Bio's goal is really to help bridge that and kind of safely enable entrepreneurs, founders to launch bioDAOs, and then also for folks in crypto to access them. Cool, we're back. So we help essentially automate their tokenomics and safely guide them through a series of milestones that enable them to get on-chain liquidity. In essence, this is really an autonomous community-owned launchpad over time. It's still a little bit permission at the moment in terms of the DAOs that we accept. I'm going to talk about some of them just in a bit. We also have some of them presenting today. Jeff, Clarice, super excited that you guys came in. Any other bioDAO founders? So Bio token holders in the future will accept DAOs that come into this launchpad, and then they run through a series of milestones that you could think of in a similar way as an accelerator. But now it's really a community-owned accelerator. And then DAOs can become liquid through a series of like micro fundraisers and bonding curves that now progressively enable people to kind of conviction stake through making funding decisions. And Bio holders through that enable the best teams to kind of rise to the top and then launch liquidity pools. These are 3 upcoming launches that we have planned. One of them is Curatopia from a serial biotech entrepreneur called Ethan Perlstein. Curatopia focuses on the rare disease market. Then we have a DAO focused on quantum biology. Incredibly exciting field. As I just said, we have Jeff and Clarice here. You guys are going to give a talk later. Is that correct? Okay, awesome, cool. I won't spill the beans then. It's one of the most exciting things that I've ever come across with, and it actually really reminds us, or it really reminded me how little we actually know about biology. Exciting times. And then another one, I think we have Rohan. I don't know if he's here already. No. Rohan Dixit from Long COVID Labs. Long COVID Labs is developing cures, ideally for long COVID. Which affects probably in the 50 to 100 million people globally. We kind of forget that COVID is still around. It's kind of, most of us have become accustomed to it. But long COVID is essentially a continued autoimmune response from the body where the viral matter has never really left. And so there's lots of people around the world that struggle with chronic fatigue syndrome because of this and a variety of other symptoms. We actually, I forgot I had slides that go much deeper into each of them. But I'm gonna skip through these and actually let the founders talk through. Actually, one of the most exciting ones, Ethan, just because he's not here, I want to give a huge shout out to Ethan. Ethan was actually one of the people that inspired me to start building something like Molecule. I learned about his company Perlara in 2018, and I actually sent him an email. I was like, hey, Ethan, do you have some time to chat? Because back then there was very few biotech organizations or pharma companies that were doing anything related to open science. So back then, open science was like super crazy. It was the idea in biotech to actually open up IP, to work in a more collaborative way is extremely foreign to most. And so Ethan was pioneering this. And so Ethan has successfully brought stage 3, rare disease therapeutics into stage 3 trials. He works with a variety of families. And so actually being able to onboard real patients and like real cures, I think, into this ecosystem is incredible. It's also one of the reasons why an increasing amount of crypto people and investors and funders are getting really interested in this space, because they're like, hey, wait, we can bring net new users into crypto. It doesn't just need to be the same speculative reference groups that I think we've seen over time. So we're extremely grateful to be building with Ethan. I was actually then, I think our team got in touch with him again in 2021. And then he came to speak at our DeSci Berlin conference, which was in May this year. And then at a party that we had, an after party, I think at 2 in the morning, I convinced Ethan to come launch a DAO with us. I think the really cool thing, for instance, about Curetopia is that fundamentally, Ethan believes that the way that we can develop rare diseases, which there's 10,000 rare diseases, but the approach to developing them can be highly standardized. And so it's been very difficult for rare diseases to actually find cures for rare diseases, because the number, there's no economies of scale. If you try to develop something for 1,000 or 2,000 patients, that's super hard to scale. But if you apply the same framework that you know works for that rare disease and that rare disease, if you apply that at scale through a community, we actually believe it can work. And then you're still targeting essentially a $1 trillion market and hundreds of thousands, millions of patients globally. And here, actually, I think it's super important to work with bioDAO founders that are extremely intrinsically motivated. One of the DAOs that has actually seen the most success in our ecosystem to date is HairDAO, because HairDAO consists of a bunch of people that are online all day trying to figure out hair loss. And they're super driven, super motivated. They don't care about the price, they don't care about crypto, they care about hair loss. And this is just a means to an end. And so I think there you're kind of really seeing powerful intrinsic incentives come to play. If you're interested, I'm going to do a super quick little shill. If you're interested in participating in Bio or Bio's Genesis, it closes on November 14th. Bio has kind of had this continuous Genesis bootstrapping method, which will be used to provide liquidity for all of these different DAOs. To date, it's actually now raised, I think, about 22 million. This is in different DeSci tokens as well as in ETH and other tokens. So there's a little bit of time to go. Tell your friends if you're interested. A little bit of an announcement. I mentioned this earlier, that different investor groups are increasingly really excited about this space. So this came out, I think, day before yesterday. We're really honored to be working together with Binance Labs, which is one of the largest investors and professional investors in the crypto industry. So they're a $10 billion AUM fund. And as many of you may know, Binance is one of the largest exchanges in the world. They do about, I checked the other day because I was trying to convince someone, 2 minutes? Okay, can I do 5? Okay. No, okay. Wait, then I'll speed it up. This is actually, so what do these bioDAOs do? This is an IP portfolio of VitaDAO, for instance. VitaDAO's IP portfolio on chain is currently valued at 16 million. And so you can kind of imagine that, so there's different bioDAOs, and each of them now has its own diverse IP portfolio that is being curated and developed through a community. This is the typical drug development cycle. This process today takes up to 10 years. 10 years, $2 billion is kind of like the going term. And what happens is, you can imagine each organization around the world is kind of doing innovation in a silo. Like they're all kind of have their own little streams. I think what's really interesting is that these bioDAOs essentially open up how research is developed. So you can now access a stream like this, but you can actually see what is happening in each of the little stages and collaborate around it. I'm going to speed up my talk a little bit because I think I've been too slow. Was it only 20 minutes? Oh, okay. Sorry, I thought it was 30. My bad. What underpins this actually? So each of these bioDAOs are using a framework called IP-NFTs, which now actually really allow you to anchor IP on chain. So IP now becomes programmable, it becomes transactable, it becomes highly liquid and data rich. So you can kind of imagine one of these IP-NFTs as a legal agreement that is combined with like a decentralized Google Drive, where you can now share access with different people, but in a fully secure way. I'm going to skip through these. If you're interested to learn more about IPTs and Vita RNA, I have a little case study here. So VitaRNA is actually a really interesting case study. So Pfizer, the organization, they invested into VitaDAO in the beginning of 2023, and then they introduced a researcher called Michael Torres, and so VitaDAO funded this project for $90,000 in May 2023, and it was then follow-on tokenized in January 2024. Raising another 300K, but directly from the community. And so VitaDAO only invested 90K into this project. It's an novel mRNA gene therapy. And in June this year, VitaRNA then raised another 300K from about 50 Vita token holders at a 1.5 million valuation. And since then, the project began publicly trading. It launched a Uniswap liquidity pool a month later and stabilized at around a 3 million valuation, which is it's like an early stage biotech valuation. And then following this, there have been a series of different data drops that are now available to the community. And it's incredible to see the project is now trading at a 14 million valuation because the researcher has continuously pushed out really, really good data, and there's an active community that is engaging around it. What's up next? So we're really excited for patient-centric DAOs that are actually starting clinical trials. This may happen as early as Q4, but probably more Q1. Then we're hoping to launch a liquidity protocol in Q4, which is going to make a lot of the DAOs more liquid. Then we're super excited about science-backed products for retail. VitaDAO actually has a first one here. This is a spermidine supplement that has been specially formalized together with researchers out of VitaDAO. Yeah, and can I still, do I have like 2 more minutes? Yeah, okay. So a little shill in the end about like bio-accelerationism, which is kind of a new movement that we've been trying to pioneer. So we have been raised to believe that we must age, and we've been raised to believe that genetic modification is wrong, that we have to rely on corporations and institutions to advance science. We've been raised to believe that pharma saves lives. And so we believe that if compute is a substrate for intelligence, biotechnology itself should be seen as a substrate for life, not something that we should be opposing. And so we believe that we should accelerate our biology and integrate it into society and culture rather than be afraid of change. So I think we've really been brought up in an age to like fear biotech and like we have to regulate it and moderate it. And there was a very similar movement in AI just a half a year ago where people were saying like, no, regulate AI, stop it, like. And so this leads into that because we believe that we cannot leave biotech up to the powers that be. So we want to accelerate longevity, accelerate neuroscience, genetic engineering, synthetic biology, fertility, accelerate life itself, and that's what BioAct stands for. There's a BioAct.life manifesto that has gone live in recent days. Please share it with your friends in science. You can sign the manifesto if you want to add BioAct to your profile, and in the future we'll be rewarding signers if they're interested with Bio to participate in governance of kind of this open network that we're creating. And so for us, BioAct really fuses 3 megatrends, 3 big buzzwords, but it actually makes sense increasingly if you think about it, which is biotech, Web3, and then using AI to accelerate all of those fields. Cool. We want to build towards a world where scientists spend 80% doing the science and just 20% applying for funding, where anyone can fund and participate in science independent of institution or geography. Thank you so much.